Good afternoon, and thank you for joining us. I'm Dr. Martha Buchanan, Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude today is dedicated to our staff who are orchestrating this weekend's testing event. This opportunity is in East Knoxville. We are pleased to provide this service in an area of the community that lacks access to testing. We also want to thank the City of Knoxville for providing the location, the parking facility at the Knoxville Civic Coliseum, the Tennessee National Guard, who will be providing some support staff for us, and the Tennessee Department of Health for providing the testing supplies. We also want to thank CAT for ensuring that public transit will be available to get people to the testing site, as this site will also have a walk-up option. Now for some details on the testing for Saturday. It's in the Coliseum's garage, so it will be protected from the forecasted rain. Testing will occur from 10 to 2 or until supplies or as long as supplies last. The test is a nasal swab, and it will be performed by KCHD healthcare professional or possibly Tennessee National Guard, who will be supporting us in that. No appointments are needed. The public can drive through or walk up as best suits them. As a reminder, anyone who's tested needs to self-isolate until the results come back, which is dependent on how many tests actually get sent to the lab. Right now, our turnaround time is around 3 to 5 days, but that can change based on volume. Now moving on to the local situation. We have 260 confirmed cases. 206 confirmed cases of COVID-19 in Knox County, 173 of whom have recovered. 31 of those have been hospitalized at some point in their illness. And currently there are 7 hospitalized. This is a new data point that we added to our website today. The figure represents only Knox County residents currently hospitalized at any hospital. This number also will be updated daily at 11 a.m. We are pleased to announce once again we have no additional deaths from COVID-19 in Knox County. Now we want to talk a little bit about reopening our community. Similar to the new data point we just provided today regarding current hospitalizations, we are continuously looking and working to identify other metrics that will be helpful to strategize how we reopen and how we phase that. We look forward to reviewing the full guidance from the state's Economic Recovery Group as we work to incorporate some of this information into our local plan. As we mentioned, the health department, local county and city leadership, members of the business community, and several stakeholders are continuing to work on a phased, data-driven local plan for our community. We know businesses are eager for guidance, and we look forward to sharing this plan with the public as soon as we have it available. As a reminder, it's important for everyone to remember that reopening is not a return to pre-pandemic conditions. Even as our community reopens, it's imperative that everyone maintains social distancing and continues to follow infection control guidelines. Now I'll open it up for questions.
Please go ahead and submit your questions at this time. From the Compass, how can the health department furlough 26 employees in the middle of a pandemic? What divisions are affected? So in being fiscally responsible, we felt it was appropriate for us to participate in the mayor's ask to furlough employees. A very difficult decision to make. At this time, given our current case count and our current situation and our current rate of increase, we are capable. We have the staff available to help manage those case investigations and contact tracing and all that goes along with that. A reminder that we have about 260 staff. So we have still over 200 people working every day to either provide some services that we're providing now or address the outbreak. Right now we have a little over 100 who are specifically working on COVID-19. There's a little bit of crossover between the two groups. So we also want to remind everybody that the mayor is on board and has agreed that if we need to remobilize or mobilize folks that have been furloughed, we can do that in order to continue to work on the response. We have a plan for expanding our teams and doing that with county staff and with our staff if we need to bring them back. Again, it was a really difficult decision. But we supported the mayor's economic, it was really a business decision, and we support the mayor's decision to be fiscally responsible.
You touched on it there, but a follow-up question was, please reconcile the furloughs with your stated need to expand contact tracing.
So I think we just answered that.
Okay. Yeah, Scott, if there's anything additional there, please go ahead and submit it in the comments. From the Sentinel at Tuesday night's council meeting, Dr. B, you said you thought the county would be able to test as many as 600 people Saturday. Is that still the expectation?
It still is. We're excited about that opportunity and hope that we'll be able to at least test 600 people this weekend.
The Sentinel says, secondly, I know the testing supplies are low, but was there a particular moment when the county recognized the disparity in testing? It seems like it took a while to get something in East Knoxville.
Well, I think I just reminded that the health department's not all that far from East Knoxville. And we did do an event in a nearby part of the city previously. And as we looked at testing availability and as supplies became available, we considered where are the gaps in testing and decided that we have do testing in the East Knoxville area, specifically the 37915 zip code, because when we looked at our data of the people we had tested, we hadn't tested anyone from that zip code. And we also looked at cases as well. So we think it's an important move. We'll continue to do that. We'll continue to use our data to help us make decisions about where we should test.
From WBIR, did KCHD have input on who are those folks being furloughed?
We did. It was a county, all county directors had input.
From WATE, what protective measures will be taken at the Civic Coliseum when it comes to protecting people walking up rather than driving through the testing event on Saturday?
From my understanding, those will be in different areas. We'll have lots of people out there to point people in the right direction and help them get to the right place. The drive-up testing and the walk-up testing will not be exactly in the same place.
From WBIR, our local counties meet the benchmarks for reopening for the most part, but there are some larger counties in Tennessee that don't. So how do we keep Knox County and East Tennessee in its protected bubble once the state opens back up?
So I think part of that is going to be that we're going to be asking everyone to continue social distancing, continue good infection control measures, and doing all the things that they're doing now. Just some businesses are going to be allowed to open up. Those businesses will follow guidelines as well, limiting the number of people in there, keeping social distancing present within the company, and all of those things, and regular cleaning. We'll be getting that specific guidance out for businesses soon. And so that's going to be happening across the state. And if you saw the county mayors yesterday, they've all agreed that they're going to implement a similar plan and do a similar phased reopening, which we believe will help keep people safe.
Also from WBIR related to that, are there fears of tourists from across the state and country bringing more COVID contamination to our area, especially since some of our area is highly tourist directed?
Certainly, we expect that that travel will increase and people will be coming back into East Tennessee. But again, there'll be guidelines in place for businesses and visitors and residents alike to observe social distancing and take measures to protect themselves and others.
From WBIR, many of our viewers say it seems too early to reopen. Why is KCHD confident in reopening next week?
I think there are a couple of things going on that make us feel comfortable with taking this step. One is that, we never had a big peak. We've had a slow increase in the number of cases, and that's pretty much stayed the same. We haven't had any big shift in that. So we believe that it's safe to reopen. We'll continue to see that slow increase. Hopefully not have a peak. If we do, we'll have to take measures to adjust the reopen. And also, to be honest, closing down businesses was never a long-term solution to keeping the COVID-19 numbers down. What's going to be really important is for us to do contact tracing, getting folks who are at risk out of the population so that we can stop that transmission. When you look at other countries where they've had to do these things related to HIV or Ebola, getting those people that might make other people sick out of the general population is really how you stop that chain of transmission. And that's what my team and our community will be working to do.
From the Compass, State Health Commissioner Dr. Lisa Piercy said yesterday there are clusters of infections in workplaces, churches, and certain immigrant communities across the state. Has KCHD identified any clusters in these or other places in Knox County?
We've had some clusters. Our staff has worked, a small number, and they've been really small clusters. So a cluster is a group of people that share a common place and have common exposures, and you have cases within that group. But they've worked with us to reduce risk to the general population. We have folks in isolation and taken really, really great steps. We have great cooperation with the people, and that's been important in keeping those clusters small and keeping it from spreading to the rest of the community.
From WBIR, we've seen some experts say that in order to really get a sense of the virus spread, communities should be testing thousands of people a day, not a few hundred. What is KCHD's response to that?
Well, I think one thing, testing is just one metric to see what the burden of disease is in our community. I know we've been talking a lot about testing, and we have increased our testing. We don't have a really great accurate number for the number of tests that are being done daily in our community, but there are other metrics to look at as well. Hospitalizations, deaths from a disease, visits to doctor's offices. We're beginning to look at those as well, similar to how we look at flu and how we determine the burden of flu in our community. So we're using those other metrics to help guide us, and at the same time working to increase testing within the health department and also throughout our community, relying on private providers to continue testing. The surge events we're doing and the testing that we're doing is not instead of private providers testing, it's in addition to, and we need those private providers to continue testing.
From the Sentinel, has a decision been reached to resume elective surgeries at area hospitals? If not, when do you expect that to happen? If hospitals are still deciding, could I ask what they're taking into consideration?
So our hospitals work together, and we've been in conversation with them, and I believe they'll be releasing more information about their plans soon. I don't want to speak for our local hospitals.
From WBIR, what sorts of businesses do you think should open first come Monday?
It's a great question, and we await the economic recovery team's recommendations on that.
From WATE, Nashville's mayor released a 4-phase plan for reopening with lots of specifics. You probably aren't ready to release the full plan for Knox County, but can you tell us how many phases this would entail or any more elements?
I think our finalized plan will be, again, based on what we get from the governor's economic recovery group. But it will be phased. Exactly how many phases, I don't know at this time, but it will be a phased approach.
From WBIR, what data, calculations, and metrics are you using to determine how and whether we should reopen? And then what would it take to shut back down?
So we are looking at our percent increase of cases each day. And again, that's remained really steady. It's increasing, but it's been very steady. It hasn't popped way up, the percent increase in cases every day. And our case count hasn't really popped up. We haven't had a big spike. So that's one piece of information we're looking at. So we know that we've slowed the spread by the things that we've done. And as we reopen, we will use data points like hospitalizations, deaths, case counts, and doctor visits. It's something we use during flu season. We get information on people going to the doctor for respiratory illnesses. We call that syndromic surveillance, looking for those symptoms. And we're going to use that as in addition with COVID-19. We've already developed that mechanism to be able to pull that information out of the hospital system's data sets, just like we do with flu, and something that's already in place, something that we already use. So we're confident that that'll help guide us. So specifically, what would make us step back? A sustained change in increase in any one of those numbers would help make us regroup, talk to our community leaders, and make a decision about, do we need to step back or not. But I think this is also an opportunity to talk about the community's role in making sure we don't have to step back. When businesses reopen, they need to really follow these guidelines. If we don't want to have to go back to where we are now, people are going to really have to follow the guidelines that are put out there, and we will get them out there soon. And individuals are going to have to follow the guidelines. You're going to have to continue social distancing, washing your hands, staying home if you're sick. all of the things that we've been doing as individuals, we need to continue that. The difference is going to be that some businesses are going to reopen, but they're going to reopen with guidance, and they need to follow that guidance so that we don't have to come back and say, oh, we did that too fast, and we have to go backwards.
A follow-up question from WBIR, where are we on the curve?
We are still, we're just kind of slowly climbing on the curve. We haven't reached if this were a marathon, we haven't reached the halfway point because we're not going back down yet, but we're slowly climbing. And what's reassuring is that we're slowly climbing. That's what we wanted to see. That's what we expected to see. We do expect when we reopen that we might have a couple of days where the increase is a little bit more than it has been after we've been open for, remember, COVID-19 has a 14-day incubation period, so it's take us some time to see that information. But we were watching those indicators very closely.
From the Compass, a follow-up to the cluster question. I know you are reluctant to identify specific locations, but can you tell us in general terms where these clusters are located? Churches, manufacturing plants, essential businesses that have remained open?
Sharing that information is really not helpful to the public. What the public needs to know is that there's COVID-19 in our community. We have community spread. And no matter where you live or where you are, you need to follow social distancing guidelines and infection control guidelines. Right. If we need to let the community know in general about a cluster, would be a situation where we can't identify all the people at risk. And then we have to make an announcement for people who might be at risk to contact us. That hasn't happened. We've had good cooperation. We've been able to identify those at risk and help take them out of circulation so they're not making other people sick. So at this time, it doesn't benefit the public to have that information. Again, the public needs to know about general infection control and social distancing right now.
From WATE, have any more citations and/or warnings been issued for failure to follow the emergency order since the last count of 8 warnings and 1 citation?
It's a great question for the city. The county, we haven't issued any warnings or citations.
From WBIR, how many people have you all tested this week? Are there supplies to increase or even just sustain that long term?
We've Monday and Tuesday, we tested right around 700 people, a little bit lower than that. Today we restarted testing, and I don't have that number off the top of my head right now because we haven't finished testing. So we're still testing right now. So we'll have that information. We have, as we said before, we've kind of cut back and changed our plan a little bit to conserve supplies so that we have supplies to move forward with, and we have supplies to test people that call us who are high risk, or help people get tested who maybe their doctor isn't testing, or they maybe don't have a doctor, or they don't have insurance.
Any other questions? Please go ahead and submit them now. Okay, since there's no other questions, we'll go ahead and log off, and we will see you tomorrow at 12:30. Thank you all so